educators for all of their kids. It's really been remarkable when you see what our kids have been able to accomplish during this difficult time. But what we heard again yesterday from education officials and what we heard from the American Academy of Pediatrics, it's absolutely essential that we get our kids back into classroom for in-person learning. We can't let our kids fall behind academically, but it's important that the American people remember that for children that have mental health issues, for special needs children, for nutrition, for children in communities facing persistent poverty, the school is the place where they receive all those services. And so this is not just simply about making sure our kids are learning and they're advancing academically, but for their mental health, for their well-being, for their physical health, for nutrition. We got to get our kids back to school. And as you heard the President yesterday, and even again this morning, we're absolutely determined to work in partnership with our states to give the guidance for states and communities to be able to safely reopen our schools. The CDC will be issuing new guidance next week, part of a 5-part series of recommendations that will give all new tools to our schools. But what Dr. Redfield made clear yesterday, I'm sure he'll make clear again today, is we're here to help. We don't want federal guidance to be a substitute for state and local laws and rules and guidance. We're here to assist with the shared objective that I think is shared by every parent in America, which is we want to get our kids back. We want to get them back in the classroom. We want to get our teachers back in the front of those classrooms. We got to get our kids learning in person once again. As Congress is still in recess, but will gather again soon, we already are in discussions about additional potential support, although we were able to remind governors that $13.3 billion is available in the CARES Act for states to be able to assist them as they roll out and restart schools across the country. At the present moment, we learned yesterday that only 1.5% of those funds has been drawn down by states, and we encouraged governors to take advantage of that. Our objectives, as I said, are to save lives, meet the needs of our states and their healthcare workers, protect the most vulnerable, and safely reopen America and safely reopen our schools. And the good news is we are reopening America. The jobs report last Thursday spoke for itself, nearly 5 million jobs created. And I can tell you, evidence all around the country is that the American people are finding a way to do their part, to put the health of their neighbors first, even while we all find a way to get back to work, to worship, and to school. And we all have a role to play to slow the spread, to protect the most vulnerable, and to safely reopen our country and our schools. And so I would just close before I turn the podium over to Dr. Birx for her report, just simply to say thank you to the American people. Thank you for what you've done so far. Thank you for the way you've put the health and well-being of not just family members and friends, but strangers, people you didn't even know first. And we just encourage you to keep doing what you're doing. Keep heeding the guidance of state and local authorities. Practice good hygiene. Wash your hands. Wear a mask wherever state and local authorities determine it's indicated, or wear a mask where you can't engage in social distancing. This is the role each of us can continue to play, and we're seeing some early indications in some of the most impacted states that Americans are doing just that. So we want to encourage you on and tell you that we're going to continue to do our part. And I'm just absolutely confident, just as we proved when this pandemic was striking so deeply in the Northeast, when it was striking in the Louisiana and in Michigan. The American people know what needs to be done, and we know we can do it. And we flattened the curve before. We slowed the spread before, and we can do it again. But we've got to all do our part, and we'll do it together. With that, Dr. Deborah Birx and